Modifier 33 preventive services which given to in the name of prevention. Okay, the preventive service is given for the preventive care. Primary purpose is delivered to evidence based upon the service in according to EVS uh, presentative service task for the A and B rating. Okay, we don't need to go into in detail part, but the 33 modifier given for the preventive services in your question will get the preventive services done. Okay, or preventive service perform. Annual wellness exam ENM plus preventive screening. Here is word is preventive is given, so we can give to 33 modifier for the preventive care. Word preventive services. Okay, modifier 47 anesthesia by the surgeon. When the anesthetologist is not giving or in absence of anesthetologist, surgeon is giving the anesthesia. In that cases we have to give 47 modifier for the general or regional anesthesia. Minor surgery, the surgeon administer a nerve block for the pain. The surgeon use the modifier 47 to indicate they provide the anesthesia. Keyword administer anesthesia, anesthesiologist is not available. Okay, so administer anesthesia by the surgeon. Okay, surgeon administer anesthesia. Modifier 50 for the bilateral procedure. When the procedure is performed bilaterally on both sides of the body, right and left, if we are not having the proper CPT code for the bilateral, we have to give 50 modifier. If we have the proper code for the bilateral procedure, in that we are getting the evidence of in the description that the procedure is bilateral, so we don't need to append the modifier 50 for that. Okay, the bilateral mastectomy is given for the both side. The surgeon used the 50 modifier to represent the bilateral procedure. Okay, the keyword are the both sides left and right or bilaterally. 51 modifier multiple procedure, when the same physician during the same session performing the multiple surgery or procedures, we have to give 51 modifier to indicate the different procedure were performed. The main procedure is listed first, followed by the additional process with the modifier 51. The appendectomy primary procedure and hernia repair is the additional procedure, so we have to give 51 modifier to hernia repair. Okay, the keyword are different procedure, separate form, additional services and same session. 52 modifier for the reduced procedure. Okay, actually it is not a procedure, it is a service. Reduced services applied when the procedure is partially reduced or eliminated at the discretion of physician. Okay, when the physician is reducing the services, in that cases we have to give 52 modifier. Okay, could due to the patient condition or provider judgment reflect less extensive services ensuring the appropriate billing. Okay, here is the example: physician scheduled to perform the colonoscopy, but the patient is anatomically uh, cannot be possible. In that cases, can only the partially complete the procedure. Okay, the anatomy of patient is not proper to perform the colonoscopy. In that cases, the procedure services reduces. Okay, in that cases we have to give 52 modifier for the reduced services. Keyword are the part of the procedure not completed, partially reduced or incomplete service. Discontinue procedure modifier 53, when the procedure is stopped due to circumstances. Okay, the patient is willing or other factor indicate the procedure could not be completed. Procedure was terminated midway, use for the patient safety or when continuation be impossible. Example is given: surgeon being an abdominal surgery but the patient blood pressure drops drastically, that's why surgeon stop to save the patient life. Okay, the surgeon stop the procedure for the patient safety. Okay, in that cases we have to give 53 modified for the stop procedure. Procedure stop before the completion, discontinue for the patient safety, unable to continue. Modifier 54, surgical care only, when the physician or surgeon is just providing the surgical care only. In that cases, we have to give 54 modifier. Surgeon is not performing pre-operative or post-operative care. Only it is performing the surgical care. Okay, the keyword are only perform the surgical procedure, separate post-operative care given to the another physician. 55 modifier post-operative management only. Okay, uh, in previous we seen the 54 modifier for the surgical care only, and another provider who's performing the pre or post operative, we have the modifier 55 for the post operative management only. Okay, and this post operative management physician is not performing the surgery. The another physician or surgeon perform the surgery, and he is just uh, take caring of the post operative. Okay, the keyword are the post-operative follow-up only, continue care or global split care. Okay, next is modifier 56 pre-operative management only. The pre-operative management in this cases the physician only performing the pre-operative. Okay, so the different part for the surgery or care given or management given by the provider, we have the modifier 56 for the pre-operative management, and previous one was the 55 for the post-operative management and 54 for the surgical care only. So remember, 54 for surgical care, next is 55 for the post-operative, and 56 is for the pre-operative management care only. Okay, so if different part of the management is performing by the different physician, we have to give the modifiers. Keyword are the pre-operative evaluation only or before surgery, pre-surgical assessment. These are the keyword to identify the uh, pre-operative management. Modifier 57 decision for the surgery. When the decision for the surgery is given in the E&M services, that result initial decision for the performing the major surgery. Okay, here is the keyword is the major surgery, which having the global period of 90 days, 0 to 90 days. Okay, and the surgery will plan for the same day or next day. The E&M service related to scheduling the surgery used when the decision of surgery occurred during the E&M service. Here is the note given for the minor surgeries, 0 to 10 days of the global period having the minor surgery. For that we have to use the 25 modifier. Previously also in the 25 modifier I told you. The example is a patient visit the physician with the severe abdominal pain. Physician decided an emergency appendectomy is necessary for the same day. In that cases, we have to give 57 modifier for the decision of surgery with the E&M code. Okay, decision to perform the surgery, surgical determination, and E&M leads to procedure. Okay, the 57 modifier it goes with the E&M CPT code. 58 for the stage or related procedure, the procedure previously stopped or rescheduled, we have to give 58 modifier for the planned surgery. Okay, stage means plan, stage or related means stage means planned surgery or related means previous stop surgery. We have to give the modifier 58 for the surgery by the same physician during the post-operative period. Okay, subsequent procedure is planned or stage, more extensive than the original procedure, therapy following the diagnostic procedure. Example is given initial surgery, debridement for the necrotizing infection, facial closure not performed, and after the 5 days facial closure was performed. Okay, for the next procedure we have to give 58 modifier to indicate that the procedure is stage or plan. Keyword stage plan, return to OR, more extensive therapy following diagnostic surgery or global period. Here you will got the confusion that the return to OR in previous also unplanned return. Okay, in that cases unplanned is different and return to OR is different. Okay, return to OR if it is unplanned, so we have to give modifier another. Okay, and for the planned surgery we have to give 58 modifier.